because if you have a has a question too, good morning, everybody. And look at that, we get Sue added on. Excellent, perfect. So we're Trinisha, you had a question regarding the exercise up here, right? Which one was it? This last week?
Appropriate.
Yeah. Week 5.
Week 5. Ergonomic.
Yes.
Yes. And look at that, you guys filled that out. So questions here. See the questions?
So we
Oh.
analyzed section 1 and then we answered the.
Yes.
Okay.
So you evaluate all your stuff, but you don't upload your pictures. I mean, you can always it's just a question of the people sometimes are very self-conscious of their stuff, etc. So I want to just give everybody their privacy and all that. So that way we don't have to worry about that. So you just answer the questions.
Okay.
And upload your answers here. And then is that yeah, it should work because people uploaded it. So that should have been okay there already. Good. So that. Is there any other question you got on last week's material? Activities, I guess.
No, I really like this week's.
The bones? Or
Yeah.
the bones?
The bones.
Good. Yeah, I know. Me too. Of course I do.
Because I want to do radiology.
Oh, good. Yeah, then those landmarks are very good to start the process of learning, because then in X-rays you see them and you position people, so you know to learn where they are on the body a little bit, so you can position people properly and stuff like that. So that's cool.
Yeah.
Anybody else have a question for last week's assignments that is just on top of your head, or because we're just yeah, go ahead, Nina.
So I'm back. Yes, I did ask about the Latin root words.
Oh yeah.
But my next question is that are we? I was a little confused if we have to know the motions in the muscles for this week, because that was kind of in the appendicular skeleton and in your book, but it wasn't necessarily part of the quiz information.
Yeah, but that's in a muscle, right? Where we getting
right.
Yeah, so yeah, that brings us into the muscle section that we are going to starting covering now. I mean, except for the facial muscles. And you have to, for the exam, you don't have to know the function or the action of the muscle. You don't have to know the attachments. You just have to be able to recognize the muscle. Does that help?
Okay. Kind of, yeah. I mean,
for the activities, we do the function as well. So you're learning.
Okay.
And then for the test, we're doing the recognition on it.
Got it. Okay.
Yeah. Good. Yeah, with that, maybe we can do. How are you guys feeling about the terms, the bones? Because we did finish the bones last week. That's the first 2.5 columns of the term list. If you have a term list, that's a fair
still a lot. Still a lot to take in.
Yeah. Because I was thinking maybe what we should do is we should start, if that's okay with you guys, with a little quizzy type thing where you guys can learn terminology a little bit, or at least can test how we are doing for the test 2 or sort of thing. You guys feel like we should do a little of that? Feel like you're open for some of that a little bit? I take that as a yes. So what we can do, it's just a few of us on the call, so we can do sort of a call in if you want. We could do a little back and forth. I go through some of the labels and the terms, and you can shout it out if you want, or we can do another format if you want. But does that sound all right?
Yeah, that's fine.
So let's start with that. So I want you guys, and I'm just using terms on the term list that that are kind of like on the test. So on the test, I could, for example, ask, what is this landmark right in here between the eyebrows? Anybody know that yet?
Yeah, I gotta look at I gotta get my paper. Hold on.
Whoever's first, say it.
The glabella?
It's the glabella. Yeah, perfect. So
Yeah,
that
I
would
didn't want to say it.
you see it too. No, that's okay. That's okay. On the, and you know, if it's so, we'll rotate a little bit too, depending on how we're doing here. So the glabella is one. When I ask on that test, I ask for either landmarks or bones or muscles, and the glabella would be a landmark. If I would ask for what is this bone called? What would that be called? Anybody?
Frontalis?
The frontal bone. Yeah, if I go and ask what is this muscle, that would be here. I don't have a picture. Oh, here would be. There's a muscle. What is this muscle called? Then you would be called frontalis.
Okay.
Okay. And then you would have a muscle picture. So then another landmark that I have here is, or actually another bone that I have is, what is the cheekbone called? Anybody?
Zygomatic.
The zygomatic bone. Perfect. Perfect. Zygomatic bone. So that's on that list too. And then how about the lower jawbone? What's that called?
The mandible?
The mandible. Perfect. And then when I look inside the skull, you have this big hole here. What is that big hole here called?
Foramen magnum?
Perfect. And then a little bit harder, it's a little harder to see here. But if I go next to the hole, we got these two ridges on both sides here. They go from the outside ear canal inward, and they're actually housing the middle ear. Anybody know that one yet?
Petrus portion.
Perfect, the petrous portion. Good job.
Portion.
And then since we're at the complicated ones, there is this little indentation inside the bone and this sphenoid bone in here. That landmark, what is that called? Anybody know? Yeah.
Sella turcica?
Very good, very good. Sella turcica, excellent. Good, good, good. When I look at the muscles a little bit, I have a muscle that surrounds the eyeball or the eye. Anybody know that?
Orbicularis oculi?
There you go, very, very good. And we'll do a couple more. We got one muscle that attaches on the corner of the mouth at the angle and pulls the corner of the mouth downward. What would that muscle be called? So
Inferior angulus labii?
Depressor anguli oris.
Okay.
So the labii will be you either have angle or lip. So the angle is here, and then the labii will be this one on the bottom here that goes around.
Okay.
So that
The labii is the bottom
the
angle.
labii. Well, the you have a labii at the bottom. You have one that's called the depressor labii inferioris here, and then you also got a labii on the top called the levator labii superioris, and that one is actually here, hidden behind here a little bit.
So what was the one just to the right that you were mentioning, the depressor anguli?
This is the depressor anguli oris, and then that is the
Oris.
depressor labii inferioris here.
Okay.
This one.
Okay, so I thought it was like the mouth at the top part. That was the depressor anguli oris.
Well, the one. Oh, go ahead. Sorry, Janisha.
I'm sorry. And then I thought the like more towards the mouth at the bottom was the depressor labii inferior.
Yeah, so the labii, you want to be going to the lip. The one here that goes around is the orbicularis oris, right? So you're going to have that first. And then the one that goes around the lip on the bottom part is the depressor labii inferioris. So
Okay, okay.
lip down, right? It depresses the lip. So when you see the word depressor, you're thinking bringing it down. And inferiorius too, you're feeling something below when you look at inferiorius. And then the other one was that anguli, the depressor anguli oris angulis for the corner of the mouth. So it goes in here. And then on top, we had the one I just pointed out was the levator. So now we're looking at elevating something. And so we're elevating the lip. And that's this one under here that goes behind here. So that's a small one the way we see it. So I'm probably not going to use that on the test. I try to be not too ambiguous that way. This here, by the way, this long one here, that's that Elvis muscle that we're not studying. We're not worried about that. That's that long name. So don't worry about that one. But this one, other one here, what is that called? The one that goes to the cheekbone.
Buccinator?
The right,
Yeah, go ahead, Tanisha or Sue.
the rhizoras?
Nope.
No.
Sue?
Oh.
The buccinator.
Nope. It goes to the cheekbone. It will be the zygomaticus.
Oh.
So the cheekbone is your zygomatic bone. And the muscle that goes to the cheekbone, I think it's better. It's a little easier maybe to see on this one. See here, go the cheekbone, goes to the cheekbone here.
Well, then will you point out the rhizoras and the buccinator?
Absolutely. So that's the zygomaticus. And then the buccinator is this
Oh,
deep
that's
one in
right, it's
here.
underneath.
So it's deep in here, going it actually compresses the cheek. That's the buccinator. And then the rhizorius goes from the corner of the mouth and pulls it backward. So that kind of tightens the lip back like that. So it's a sliver on top. So the buccinator is deep. The rhizorius is superficial on top.
Okay.
And then this one here, what is, anybody have idea that one? The big muscle on the side?
Mm,
It's closest to mouth.
Masseter?
Yes, very good. Masseter.
Mass-
Masseter. So that goes from the cheekbone again, the zygomatic, and pulls down onto the mandible and up that way. And then we do have another muscle that closes the mouth, and that's one behind above the ear on the temporal bone. And it goes down to in here, underneath in here. Anybody have an idea what that muscle is called?
Hmm.
On the bone. It's on the temporal bone. Temporalis. You see that on the list is under the muscle, under the facial muscle terms. It's
Mhm.
the second from last term. You see it? So that's the temporalis muscle. And you can remember it's the temporalis is above the temple. Does that make sense? So you know, I always look for these kind of commonalities to help me have an understanding of you know, a little mnemonic-y thing that we were talking about. All right, so those are the facial muscles. You pretty good with that, or you have some more questions on those right now?
No, those are, I think that's good.
That's all right? All right. Otherwise, just speak up. We can always go back to it. Then we can go to the vertebra a little bit. When I look at the vertebra, this is a pretty good generic vertebra. We have these parts to the vertebra that we're studying. So the big part here, what is that big part called? Anybody?
the body.
The body, perfect. And then on the, so that's in the front. So you can't really touch that. That's like in the front going backwards here. And then if you reach back, this tip in the back, you can touch it with your finger in the back of your spine. What is that called?
Spinous process.
Spinous process, very good. And then what we want to make is we want to make an arch here. We want to make this vertebral arch, because what goes down here is basically the spinal cord goes down, up and down through it. So it's nervous tissue. It's very soft. What is the bottom part of this arch called here? These two pillars that come off from the body, vertebral body. Anybody?
Pedicle.
Pedicles, very good. And then on the side we have these pieces that stick out, and they go to the side, and they are called
Transverse process.
transverse process. Very good. And then from them backwards to the spinous process, we have another bar-like structure that closes the vertebral arch. What was that called?
The laminae.
A lamina, yes. Hi. So perfect. So that gets us these basic parts on the generic vertebra, or on every vertebra, except the arch that we're seeing over here. Pretty much we have all these pieces. We also have, you can see here, this is sort of a fairly thick structure. And actually what this is there's more terms to it. There's joints that are made with the vertebra above and the vertebra below on these points. And so when you look at the spine and carrying the weight of the body downward, you carry some of the weight here that connects with the vertebra above with the disc, and then in the back as well, you have these joints that hold the spine downward. So that's if you were wondering what these are called, but I'm not labeling them because it gets quite complicated to learn it in this first time around the block kind of learning. But we can look in the lab. If you guys come to the lab, we can look in the spinal column. You can see it. I can point it out to you, the way it looks there. Then we have this vertebra here. That's a ring-shaped vertebra. What is that one called? Anybody?
The atlas.
That's the first one in the spine. So the top vertebra, which connects then to the skull up here, this piece is here, right down in here, which I don't have a good picture of, but they're right next to the foramen magnum. The condyles, the occipital condyles, will connect with this part of the vertebra here, and then the head sort of sits on that ring, and then the ring goes over this second vertebra, which unfortunately I don't have a picture, but you can kind of see how it comes down, and then it sits on the second vertebra. Anybody know what the second vertebra is called?
Axis.
And then we have this little thing sticking up here, this thing that then goes through that first ring vertebra. Anybody know what that point is called?
The dens.
The dens, very good. And so you can if you can visualize then, so you have the second vertebra and the ring vertebra on top, and then above there's the head sitting. And so you can kind of see how this vertebra rotates around this dens, and that gives you that rotation, the no motion, the rotation around the up and down vertical axis. So that's where 50% of the head rotation actually happens in here.
Professor, what is condyle like translator? What's the Latin root word? Because I know it's in everything, and like I know a process is something that sticks out.
Yeah, and actually we're gonna have to. Oh, look at that! I'm looking at that list that I just got out for. We gotta. Yeah, I have to look it up. What exactly it means? Forgot. It always makes a joint. Together. Con means together.
Okay.
Con means together, and then that's dial. I'll bring the list. Are you coming tonight or Wednesday? I'll bring the list.
Yes, I'm gonna come tonight.
Okay, perfect. I'll bring that list in. And we can see after the class, maybe the main class, maybe we'll stick out real quick. I can see if I can give you that link, figure out if we can give you that link. Sort of a communal site where you have to upload something to be able to download something.
Oh, that makes sense.
And so I have to see, I have stuff to upload for people that might be interesting. So I have to see. And then if I can download it, then I can just put a link on and share it on. All right. Anyway, but this is these, but basically for us, a condyle is making a joint.
Okay.
So when we see the word condyle, we think joint. Okay. We have big ones in the knee, for example. All right. And so the other thing that if you see this from the side, you see the body here, you see the spinous process here, and then the transverse process is here, but you see this structure here, and then the structure here on top. That's what connects with the vertebra below, and that what connects with the vertebra above. So they sit on top of one another like that in the back. And these surfaces here are not called condyles. These surfaces are called facet. That's another word that we want to use for joints, facet, F-A-C-E-T. It's not on the list, but just that way you can create that kind of framework in a head as, joint terms, and then, yeah, if you guys, at some point I want to make my own list for the class, but everything is always so much work. I don't get to do it. So what I do believe though will be very helpful if you make your list of terms of surfaces, weaknesses. So they do sell booklets. I'll try to figure out that list, but also just whatever we come across, just notate it down, and you start creating a vocabulary that's pretty comprehensive over time. All right, so then that was the vertebra, I think. Are we having any questions more about the vertebra before we go to the sacrum?
I just wanted to ask about the unique features of the cervical vertebra and the thoracic vertebra.
Mhm.
I mean,
Yeah, let me pull that up on here. Yeah, keep talking, keep talking.
it says that the cervical vertebra are bifurcated, which means that they're forked. And so I guess, do you have a photo of like how you can tell the difference, or like, is there a way to remember that?
The easiest is if I show you in lab.
Okay.
And in terms of the test, I'm not focusing on those differences. It's good to know
Okay.
that, right? I think it's good to go through them. That's why I put them there, because they're fairly distinct. Let me see if I can pull up my second lecture material for that. Okay. Then I can show you. You got it in a booklet though, right?
Yeah.
But not everybody's got a booklet. Here
So
we go.
after that,
Yeah, go ahead.
Are you talking about the pelvis part?
No, we're talking about the
Sorry, I
specific
was off.
features between the vertebra and the neck, the
All right.
vertebra in the mid back, and then the thoracic, and then the vertebra on the low back. So let me lecture briefly on you here. Let me see
If you
After that,
have the booklet, it's page 43.
if you guys have. Okay, perfect. So for some of you who have the booklet, let me just open that and then share this part with you guys. Oops.
After that, can you explain the pelvis part, because I
Yeah.
was watching the video and I wasn't quite understanding what you were pointing at.
Yeah, no, we can absolutely. I want to make sure we spend some time on that part after that for sure.
Okay.
Because now we're just sort of leaving the spine, and then we go to the sacrum, and then we go back, and then we go to the rib cage, and then we go to the extremities. I want to make sure we have you guys at least have a general understanding for those terms. Okay, at that for last time. So what was that at? Oh, here, unique features. So that was at. You can see this. My PowerPoint, good. So that was Atlas and that was Axis, and they stick together like that on top of one another. You can see it in situ in here. Oh shoot, I shouldn't move this stuff. Darn it. That's my live PowerPoint. Oh my God. You can sort of see it in situ here. If I can make this bigger. Can I make this bigger? There we go. So you see how the head sits on top of it, and you can sort of visualize how you can rotate it around. But when we get to the next one here, then we get to the cervical spine itself, the vertebra. And so we have a few specific features. We have a bifurcated spinous process. That means the spinous process is not a round bump. It got these two things to it. It forks, like it goes into two. And the reason why it does that is that when we bring the head backwards, one can lay over the other one and they don't jam into one another. And so we can extend the head better. We can bring the head more backwards and it doesn't jam into each other. Because you already have a curve that goes forward or backwards in the neck that way. And so it would just jam really fast. And so that's one thing. The other thing is that transverse foramen. And if you look down here, what happens is you got here you can see how the neck sort of needs to, when it extends, how these jamming happens in the X-ray. You can sort of see how they need to lay on top of one another. That's why we have that bifurcation. Then the transverse foramen, when you look at the word foramen, it's always a hole. And it's pretty much always some vessel's going to go through it. It's either an artery, a vein, or a nerve. Here, red is an artery. And so what we have here in that hole, we have an artery that goes up the neck and then feeds the posterior part, the back part of the brain. It's called the vertebral artery. And so that's unique to the neck.
Is there only one transverse, is there only one artery going through there, or does it?
One on each side.
Oh, there is one on each side. Okay.
Yes, is another one we can look at the spines again tonight. You can see it. It's there on both sides. It goes up. It's that red cable thing that goes up.
So if I'm looking at your picture right now on the specifically on the top, the bifurcated top,
This one.
yeah, over to the left and where it says transverse process, and there above the transverse process, there's two holes up.
Oh, this.
Yeah, are
That's it.
those the,
Yeah.
that's the transverse foramen? Okay.
Yeah. Why the heck is that no label? Jesus. I got to create a label there. I didn't even catch that. Yeah, of course I should. That's the hole.
Okay, cool. No, that, so
Right,
is
that's
if
the hole.
one's an artery, is the other a vein?
No, they're both arteries.
Okay, okay. Cool.
And actually, you know, that's actually a good question. I got to look it up in the book if the vein is there. And very often you have artery and vein go together. They
Okay,
travel together. They often actually travel. They call that a that's a side topic, neurovascular bundle. They often, the arteries, the vein, and the nerve, they travel together as the threes because they're stronger that way.
okay.
You know, they can be together bound and then they don't rip or they don't pull or they whatever is happening in the body. So that's the unique feature for the neck. All right. We have, and then we do have one more. If you see here, what's in here, you see this on the side of the neck. It's not straight. It goes up a little bit on the side. And so there is actually extra joints that we have in the neck on the side. We're not really worried about those, but if you're wondering why is the neck crowd a little bit like that? So that's another unique feature. But they just, since I've graduated from chiropractic school, figured out that those are real joints. So some of that stuff is actually not set in stone, I guess. And so that's an onset process. We're not going to worry about that. That's just in case it comes up later. When you look at this, the second part, the thoracic vertebra, you have two of them. There we have the costal facet and the long spinous process. Facet again makes a joint. All right, that's another word, like condyle, facet always makes a joint. So when you look at the ribs go around from the back to the front. As they go to the back and they come into the spinal column cord, they have to go and attach to a few parts. And so we're gonna have a bump here on the transverse process that is creating a costal facet. Right here, you could see that. Here it's on the side, the way it's blue. And then as the rib comes forward and attaches into the vertebra, it has these demi-facets, these costal facets. They call them demi because the rib actually enters and attaches in between two vertebrae. Like the rib comes into here, right into here, and there's a little part of the top vertebrae that attaches and a little bottom. So that's why they call them demi, as in half. Demi means half.
By the way, I just looked up facet and it's a French word that means face or side. So that's why they're called facets.
And it's that flat surface. It's sort of a flat thing. Yeah.
Because like I'm seeing like 4 different ones and they all like look like little faces.
Yeah, no, that's very, very good. See, I see that's the way exactly how anatomy goes. And I've done it many times. I didn't even look that one up to like that level of detail. You know, the more you understand the foundations where these come from, the more it becomes a visual thing. And the easier the terminology gets. Because you got to take it away. The problem with terms is it's just words. They don't mean nothing. We got to give them these meanings, you know, and often we can do that through the description of how it looks, for example, you know. All right, so that's the things we have here. And then the other piece besides the costal facets is that when you look at the spinous process, it's really long and slender and it goes down and sort of it creates this ridge in the mid-back that's protecting the spine above and below a little bit too. So if you fall on the back, it don't get too pokey. All right, so that's the mid-back, and then the low back and the lumbars are mostly, what is that? They're large bodies. They're just big because there's a lot of weight coming down, or the whole spine's coming down. And then the spinous process, they're not pointy, but they're sort of, they call them blade-like or spade-like, not blade-like, spade-like in the back. That was always weird for me, but they had to give this kind of a name. It took me a while to understand why is this a name for that. But so basically the lumbars are really just big. All right. Because like it's you go into a bio 2 or sometimes in the classroom, I can, ask you which section of the spinal is that from, and this vertebra, and you could sort of look at it, go like, well, it's got a hole in the side. That's probably neck or it's small, and those are these features becoming handy for that from a lab's perspective. Clinically speaking, yeah, later on, I'm sure. It's mostly how big they are. And then clinically speaking for us, it's like, how do the joints work and how do they orient and so forth. All right, from there then, what we have is we go back down to the coccyx. No, not coccyx. Where am I? Sacrum. Is that good, Nina? The separation stuff, the uniquenesses?
Yes, that was super helpful.
All right, good. Yeah, we can do this. That's totally good. I like the way the class goes this way like that. And then we have the sacrum, is basically fused vertebra, and we have some features that we want to know there. The top, actually, if you look at the whole thing, it's an inverted triangle kind of looking thing. So you got the top here is called the base, and where it comes to a tip is known as the apex. And that's on the list. And then we have these, if you look from the front, you have these lines. And I should ask you these questions. What are these lines called here? These are remnants of the discs. Anybody? The front lines, it's on the list. It's one of the few terms I want you to know there. They're the transverse lines or the transverse ridges. So they're basically fused, but you can still see the remnants of the intervertebral discs, because as we get created in the embryonal stages as embryos, we are actually cartilage. The skeleton is cartilage. If you see over here, this is a breastbone here, and here are the cartilages that come out from the breastbone. That are these things on the side. They're mobile a little bit. We are all that kind of skeleton in the womb, and then if it ossifies and it fuses together, and we learned some of that in chapter 4. And so these lines here are these remnants of these intervertebral discs that we can still see. And then if we look in the back of the sacrum, you have this middle line going up and down, these bumps. And what is that called? That middle line here. It's also on the list.
The medial sacral crest.
That's the medial sacral crest. And these are the leftovers of the spinous processes. All right. When you go and the bumps in the back, you feel the bumps in the back of the butt too. Those are those bumps. All right. From there, we can then go to the sternum. And when we look at the breastplate, the sternum, we have a top portion that it's on bone. What is that called? And when we go down a little bit, there is a little bit of a bump that's an angle. That would be this joint right here. And then we have the lower part. So the top portion is known as the manubrium. Manubrium. If we move downward in the bigger part, the best guess for something that's the biggest part of a bone or so is called the body, most likely. Or that's a good guess for something like that. And then the tip of the sternum, anybody have an idea what that one is called? The tip of the sternum?
The xiphoid process.
That's the xiphoid process, correct. That's I think that's a cool name. It's a very important part. You don't want to push too hard on this. You want to keep that alone. And then the last thing here, the true false rib, it's not really on the test, so you don't worry about that too much. But when I look at one rib, so this is the front, and then it moves backwards, and this is the area that moves into the vertebra. What is the thing called the top of the bump here that goes into the vertebral bodies? and has a joint with those?
The articular facet.
That would be the head of the rib. Look on the rib.
Oh, that's the head. Okay.
So when you look at the rib, the end that goes into the sternum, we're not really worried about that. That's just going into cartilage for our sake right now. But we're looking at the ends that makes joints with the vertebrae. And we have one bump here that makes the joint with this transverse process as it comes into the spinal cord. And then it narrows a little, and then it has a bigger bump, and that's where the connection with the vertebral bodies is. And the bigger bump is known as the head, like in us, the head. And then where it narrows, we call that the neck. And then the next bump down here is it's the tubercle. Did you say tubercle, Nina? Oh, okay, good.
No, I said articular facet.
Okay, good. All of a sudden I was like, wait a minute. So that's the tubercle. So we have the head, the neck, and the tubercle of a rib. And so on an individual rib, those are sort of the main features I want you to be aware of for this test or for this class. Cool. Well, let's see what else we got. Tonight in class, we're going to do the upper extremities. Did you guys go through that already? Do you feel you have some questions on those? Or did you, that was for finishing up for last week, right? The labeling, were you able to do those yet? Yeah. And on those, I just want to, we don't have to go through them yet. I'm going to go through more of those, I think, next week. We're a little, because we got to process this material. There's a lot of material. But for now, on those upper and lower extremities, the questions, do you have any questions? I know there's one about the pelvis, right? Who had that question? Wasn't there one about the pelvis?
I thought Tranisha had a question about the pelvis.
Tranisha, did you have a question about the pelvis?
Yes, I did. I
Good.
don't
Let's do that now. Is it still in the head?
huh?
You're still remembering it?
Yeah, a little bit.
Good. The question.
Oh, the question.
Yeah. Do you have a
Um,
question?
I had to leave real quick, so I don't even have my questions with me.
Okay. Do
Can
you
you just explain the side parts a little bit?
the
You
who?
know, on the
Pelvis?
huh?
Are you now talking about
Yeah,
the
that.
pelvis? Which parts do you want to talk a little bit about?
If you pull up the picture, I'll let you
Let
know.
me bring it up here. Give me a moment. It's asking a lot from this little computer. There we go. Pelvis. So you said from the side, the outside view?
Yes,
All right.
right there at the top. We just passed it.
This one?
Yes.
This
Can you-
one?
No. Yeah, that part and then that part too. Can you please explain that to me? Like, because you said the side around the go down. Yeah, around this part is the lipus fossa. Did I say that right?
Iliac fossa.
Oh,
Yeah, no, that's good. That's pretty good. So you need orientation of what we're looking at, or
yeah, because I didn't understand that part in the video.
okay. So what we're looking at here is the pelvis. So if you come down with the spine, we come down from the back, and then this is the sacrum. We just talked about the sacrum a minute ago, right? And then we have to figure out a way how to get into the legs. And so the body made this hip on both sides, this pelvis made up of a few different bones. And we, of course, have a lot of landmarks. And so this is a view from the front. So looking at it. Does that make sense? What we're looking at? The way we're looking at it?
Yes.
Okay, great. And so when we look at the terminology, was that where it got a little confusing for you?
Yes.
Okay, so let's look at the terminology a little bit more. Let me go with this picture. And so when I look at this picture, this is from the side. So there's one on the right side, there's one on the left side. So we're looking at one of these hemispheres coming from a side pictures. And this is the front here, and this is the back here. And so when you look at the terms, you have a bump in the front, in the back, where you can, a big bump, and then you have a crest that goes around. So when you have a baby, for example, you have the baby sitting on your hip, the baby's going to sit on this part. So the baby's going to sit on your hip. It's going to sit on the iliac crest. And if you follow your own crest to the front, you're going to feel a bump in the front of your hip. And it's kind of a sharp bump. And that's known as the anterior superior iliac spine. Anterior means front, superior means above. There's one below. So that's that part. And iliac, see the different colors of these bones. This bone is technically called the ilium. So everything that goes on with this bone, they call iliac. Iliac, 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 everywhere there's iliac. And then this is fused, but originally in the womb, that was the second bone. And this is the sit bone. That's where you're supposed to sit on. And that's known as the ischial tuberosity, or actually the whole bone is known as the ischium. So everything on this bone, on this purple one, is ischium, ischial, all that stuff is ischium. And so the sit bone here, the big one, is called the ischial tuberosity. So that's the one in the back. And then when you go to the front, you got this red bone, and that's your pubic bone in the front. Where you come from here, you find this on you. You can go a little bit to the medial side, a little bit down, and you find the bone right underneath the bladder. If you push into the bladder, you're going to have to go pee. But right underneath it, that bone, that's the pubis bone. And that's this one right here in the front. And so that bone here, the red one, is known as the pubis. So here, pubis. So we have a couple of landmarks on that. When you look from the side, where the hip, the femur goes into the bone, into the pelvis, that's known as the acetabulum. So that's one thing on that list. Does that start making some sense to you, Tranisha? Or everybody else too, for that matter, of course.
Yeah, I was more so concerned about the yeah, I'll just have to study it a little bit better. But I kind of understand.
Okay. Oh, you come into class, right?
Yes.
Yeah, we're gonna do the whole thing today on that mostly. Or this
Okay.
week. What I want to do in class this week is I want to go through the so the bones, have review of this, have all of that review again, and then go through the extremity bones. And then now we're briefly probably gonna go through this week, and we're gonna start with the muscles on the online section. So you listen to the lectures, and do a few things. Well, first we're gonna have a session where you look at muscle function. That one is, you might want, that one can be a little technical. That's physiology. So make sure you spend some time with that and the questions on that. And then, next week we can talk in class about that too, if you want, or here too in Zoom, and bring questions, especially about the physio part. And then we'll start going into the trunk muscles this week, and look at the muscles that make up the trunk, a lot of postural muscles. And we have a labeling and coloring exercise on that, besides, of course, the questions that always come with it. And then we did the ergonomic evaluation last week. Did that work out okay for you guys?
I haven't done it yet. I got to do it this morning. The coloring and the lectures are a lot that, yeah.
Yeah.
So-
It's okay if we're a little behind. It's also that I'm front loading a lot of the terms, in part because the muscle terms have more with them. The muscles attached to the bones and things, but also in terms that we have lesser terms coming at us to memorize for the test. all right, as the next few weeks go on. At least that's my hope. Yeah, you know, it's so funny you saying that about the ergonomic eval, because I have to create it so it's in the page and not in a pamphlet that you gotta look at. And I have to look at my own. I'm going like, oh, I got horrible ergonomics. You know, don't do as I do as I say, right? But it's good once in a while to look at that. So yeah, don't worry if you haven't done it. I think about a third or half of the class has done it so far. It's okay if you guys are a few days behind these things. Don't worry too much about the penalty. Of course, it always stings slightly, and that's what I want. So we're staying on top of it, and it's not like, oh, 3 weeks later we forgot something, you know. And if and so that's that. If these penalties give you a great problem later on, don't worry, we'll talk about it. Because at the end of the day, you and I make the grade, not the computer. Okay, just so you know that part too. But then this week also we're gonna talk about posture. I'm going to go through a posture evaluation. So now what I want you guys to do is I want you guys to take some pictures or have somebody take some pictures of you, or do a tripod or something. This is me. What you do is you march in place. You sort of come to a neutral stance where you feel like you're standing okay. Ideally, you have your eyes closed. If you have to, you know, do your own 10-second and then you have to run the front of the picture, then that might be a little hard. But do the picture from the back, a picture from the side, a picture from the front. And then we got these landmarks that I want you to point out. And do I say with a dot or something? Yeah, make a little label dot. Like I have these little color dots that I put here, or sometimes I take some tape and some color stickies or something, just to place some stickers on these different landmarks that we've studied now. So now you can look them up and see where they're at, and you can actually look them here where they're at on me as well, right? And so then you do that before you take the pictures, and then you take the pictures in a neutral posture where you feel like you're standing normal, meaning like you're straight. And then you look at your picture and you go like, oh, shoot, I'm not straight. Because you can compare and you can go down here and you analyze it. And I have a picture laid behind this, a graphic where you can print it out or do it yourself as looking at the picture or mark the picture up or so. But you want to see what are your deviations from normal or ideal posture, not normal, ideal posture. Because posture is actually, I should have started with that. Posture is the ideal position of your skeletal system that you use as least amount of muscle energy, muscle contraction to stand upright or to be upright. So if you're sitting like that and your head is forward and your gravity goes down, your muscles here have to work really hard to keep your head up. And after a couple hours of that situation, that posture, you'll be tired, maybe even have a headache. And so posture, knowing that the head should be over the shoulder, and maybe we retract the chin a little bit and work with that a little bit, and it's like, wow, these muscles are starting to relax, then you start also using less energy and you're less tired. And so that's where posture is really important. It's not like, oh, your mother said or your father said, stand up straight. Of course, that's as teenagers, I had that all the time. I'm interested in this because my posture is not that great, right? So I want you to do a little analysis of that and go through this exercise. And then you also can observe, watch this video. It's only 4 minutes. It's another one to sort of think about it a little bit. It's from a physical therapist. It's a good one. And then I want you to answer these questions here. Yeah, why is posture important? Right there. You don't get so tired or headache, or you use up your joints faster because you're all grinding against gravity and stuff like that. And then second part, I want you to go through a few exercises that are shown. I mean, the biggest postural deviation is the head forward. Everybody's looking down, especially with the phone. And so we want to have exercises where we can bring the neck back. And so those are a few that we learn here. The retraction, that's a good one. And then stretching the neck in the back is also good because those muscles are tight, those back muscles. Stretch the sides. So we go through a few of those. Also the front, because we're curled forward like that all the time. And so these pecs, these front muscles get really stiff and tight. And so if we do spend a little time stretching those out, that's good. And what I want you to do is I want you to go through them a few times. I think maybe it even says 5 days. I do them, go for them a few times, follow those instructions, and see if they make a difference in how you feel, or maybe they make you less tired or something like that. Or maybe you're boring, and then next time in the discussion you can say that was damn boring. But I want to spend a little bit of time as we finish talking about the skeletal system and get into the postural muscles to think about posture. These trunk muscles are the ones that hold us upright. All right, that's it for that. Look at that. We're going way overboard, but that was all right, right? We're going through a little detail more with the bones. You guys okay with doing it that way? Who on the call? Anybody? Yeah, good. All right, so then, bene. That's the second exercise for that, and then we just finish up the Padlet, and that's it. All right, that's it for what I have. How is that for you guys? Sensory overload? A little bit is okay. We're slowly integrating it. All right, it's great you guys on the call. Then we talk about it a few times a week. I'll be okay. All right. Good. Any final thoughts, questions right now? No? All right, good. Well, then let's call it a quits, and then we'll see you guys later, some of you, or Wednesday. And it's wonderful to have you in class, and so glad you joined today on Zoom, and really grateful to have you.
Thank
Thanks
you.
again.
Thank you. Bye.